primary prevention. You're not talking about secondary prevention. And so those are people, for those listeners who aren't familiar with those terms, those are the people who don't have cardiovascular disease already. And the question is it worthwhile to start the medication in someone who doesn't already have cardiovascular disease in hopes to prevent it? So primary prevention. And of course, we all know that there are risk factors for cardiovascular disease. And of course, people who have multiple of those risk factors are more likely to go on and get the disease than someone who doesn't have them. It's pretty basic stuff. But what you have to look at is the studies that are done and whether it looks like primary prevention with a statin medication is justified. And so if you look at those numbers, the studies, in my opinion, don't really pan out, even though the researchers do report, in men at least, that the primary prevention with a moderate dose statin helps reduce the occurrence of a heart attack or death by, an endpoint of death by heart attack or whatever, enough that they say it's statistically significant. Well, it turns out that if you look at the absolute risk reduction, it's only about between 1% and 2% absolute risk reduction for men. And if you look at it for women, it's only about between 0.5 and 1 percentage point. And that's actually not statistically significant, whereas for the men it was. But if you think about it, or if you let your patient decide, they're going to say, there's no way I'm going to assume this side effect profile for this medication for that small of a reduction.